Leading-edge medical research recently revealed its findings on the genesis and treatment of chronic pain and stress in the body, and the results are astounding. It turns out that scars in their multiple forms, especially surgical scars, cause 80% of the chronic body-wide pain and sympathetic stress that's suffered by most of the world's population. Scars are the residual dermal and fascial tissue disfigurement resulting from physical trauma, intended through surgery and unintended through injury. The king of scars is the surgical scar, particularly abdominal or thoracic scars. They cause chronic body-wide pain or chronic post-surgical pain in up to 30% of surgical patients within 1 year post-op. That's what The Lancet, one of the top medical journals in the world, reported recently. That, along with the scientific realization that 90% of that pain isn't at the site of the scar. It's found in other parts of the body directly connected to it through the underlying injured fascia, which slowly, over time, pulls the body further and further out of alignment, causing chronic body-wide pain. In the US alone, over 3 million of these top 5 pain-producing surgeries are performed annually, producing close to 1 million chronic pain patients. The little-known fact is, scars are any kind of trauma that causes the body to heal or lay down more collagen throughout the body. These include cuts, puncture wounds, sprains, torn muscles or ligaments, falls, burns, and yes, even tattoos, including medical tattoos that cover up surgical scars, cosmetic tattoos and microblading, and the fun kind that have recently become a fashion must-have. And the trend is with those, the bigger the better. If that information isn't hair-raising enough, there's one more silent but deadly scar that's potentially the most debilitating of all. And that's the scar caused by emotional trauma. Human tissue records and stores the surroundings and emotions of a traumatic event, leading to trapped emotions that lead to various types of psychological and emotional pain, and in the worst cases, PTSD, or what's now referred to as PTSS, or post-traumatic stress syndrome. The Center of Disease Control says 61% of adults in the US experience at least one childhood trauma, directly linked to the 21 million cases of depression, 2 million cases of coronary heart disease, and the plethora of other stress-related diseases reported each year. Add 48 plus million surgeries combined with 25 plus million injuries and tens of millions of accumulated emotional traumas, there are literally hundreds of millions of scars being caused by choice or by chance each year in the US alone. In order to counteract the negative effects of all scars, the injured fascia needs to be treated or released so it no longer pulls the body out of alignment, causing the chronic body-wide pain it otherwise eventually will if not released. There have been 0 known medical procedures able to nip the nasty bite of scars in the bud, or even reduce their size, until now. After 15 plus years of clinical research and trials, the Dolphin MPS Neurostim has arrived. It's the first modality in history that reduces scars both topside and in underlying fascial adhesions, significantly decreasing the body-wide stress and pain they cause most of the world's population. The Dolphin is a patented solution based on the scientific concept of increasing the skin's intercellular metabolism, protein synthesis, and healing functioning to reawaken the skin's ability to self-generate. By targeting direct cellular stimulation of microcurrent waves through scars, This simple and discomfort-free procedure reduces dermal trauma and the resulting adhesions and fascial restrictions. SRT is a proven groundbreaking therapy, so effective it can be applied clinically and so safe it can be applied at home. Up to an 80% reduction of scar-related issues may be achieved after a single SRT application. SRT may be applied as a standalone therapy or as a clinical adjunct to other therapies for even greater improved outcomes. The Dolphin SRT is the only current scar reduction solution available that delivers consistent healing results, decreasing the debilitating chronic pain and stress scars cause. Here's what celebrity practitioners have to say about the Dolphin SRT. Internationally renowned author and lecturer and manual therapy practitioner James Wislasky said, "After an unfortunate mountain biking accident, I experienced unbearable nerve pain in my right low back and legs for months. Manual therapy alone was not working for the pain. After the scars were treated with SRT, my nerve pain went from 9 to a 2 in just one session. I'm now integrating the Dolphin into my manual practice." Occupational therapist and lecturer Kelly Armstrong, known as the Queen of Scars, says, "I've been treating patients with the Dolphin for over 16 years now, and I haven't seen anything else available on the market that can deliver the pain reduction percentages that the Dolphin does consistently in my patients." If you're a clinician seeking improved functional outcomes by integrating SRT into your facility, or a patient who suffers from chronic pain who has suffered surgery or trauma, the Dolphin SRT is the leading solution for your scar therapy. The Center for Pain and Stress Research, in cooperation with Acumed Medical, offers scar release therapy training to healthcare practitioners throughout North America and the world. For more information, contact the CPSR through dolphin-courses.com or call 1-800-567-PAIN to speak to a representative.